Hello everyone, I'm Dr. Yuanlin Piao. For more than 20 years, I practiced and taught Chinese medicine in top hospitals in China. And across all those years, I kept noticing the same problem again and again. Most practitioners can memorize formulas, but very few can actually design formulas with accuracy. You know the herbs, you know the classics, you may even recognize many standard patterns, but when real clinical cases appear, mixed patterns, layered mechanisms, contradictory signs, the formulas suddenly become unclear. At that moment, memorization stops working. Memorization versus design. Single herbs are easy to remember because they are tied to clear, dramatic symptoms. This kind of thinking is useful for simple, acute problems. But Chinese medicine was never meant to treat isolated symptoms. Formula design is about structure, coordination, and synergy. It is not about stacking herbs. It is about understanding how different actions work together to produce a unified therapeutic outcome. This is where many practitioners struggle. They treat the branches, they chase symptoms, but experts treat mechanisms. Seeing the case as a process. In Chinese medicine, the most important question is not what is happening. The most important question is what is unfolding. Illness is not a static picture. It is a process unfolding across time, space, and the whole person. Is this condition just beginning? Is it accelerating? Is it stabilizing? Or is it already collapsing? This is movie thinking, not picture thinking. When you see a case as a moving system rather than a frozen snapshot, your prescriptions change completely, from mechanism to design. Expert-level prescription design begins with mechanism mapping. You learn to identify the core driver of the complex case. You distinguish primary mechanisms from secondary ones. You see how a formula should be constructed directly from the mechanism, not from habit. From there, you translate mechanism into structure. You assign roles: 君、臣、佐、使, chief, deputy, assistant, envoy. You balance temperature, direction, action, and organ targeting. You adjust formulas not mechanically, but intentionally. This is not theoretical. It is clinical reasoning refined through experience. Why this matters? When you understand formula design at this level, you stop relying on memorization. You read cases more clearly. You identify true mechanisms. You design formulas with precision. You practice herbal medicine with confidence, not because you remember more formulas, but because you understand why formulas work. This way of thinking has shaped my clinical work and my teaching for decades. It is how I approach complex cases, chronic conditions, and mixed patterns. If this perspective resonates with you, if you believe Chinese medicine is about structure, process, and mechanism, then you are already thinking like a formula designer. Thank you for watching.